One company is providing Medicare patients with better care at lower prices, 18% below the industry average. CareMore has a unique approach to caring for the elderly, and its track record speaks for itself. Liba Lesson is the president of CareMore. Liba, thanks for joining us, and congratulations on your track record. I think most of us look at these numbers and we say to ourselves, how can they do this? What is the secret?
Well, it's my pleasure to be here and happy to tell you that the secret is actually fairly simple, which is we call it a maniacal attention to detail, making sure that healthcare conditions are managed very closely and very completely, and we can avoid very large catastrophic events for patients, which is good for their health and it saves money.
So how can quality be improved while costs are reduced?
Well, we think that the starting point is to understand what we're spending our money on. I'll give you an example. At CareMore, we do a foot exam on every one of our diabetics every month because it is the case that an uncontrolled sore or blister on a diabetic's foot could result in an amputation, and an amputation is just the beginning of a long stream of bad health care. So we would rather pay for a weekly or monthly foot exam for every diabetic and keep their feet healthy rather than letting conditions get out of control and a future amputation.
Well, and that is attention to detail. Let me show our viewers some more of your results, which are truly impressive. Your hospitalization rate is 24% below the industry average. Hospital stays, 38% shorter. Diabetic amputation, you just mentioned that the rate is 60% below the average. I mean, to me, this is mind-boggling and completely contrary to what's going on in the rest of the industry. How can we get the rest of the country and other companies to think about operating in this fashion?
Well, we think to operate in this fashion, what companies have to do is zero in on the 15 to 25% of the patients that they take care of and make sure that literally every detail of their healthcare condition is managed. I think that some of the more enlightened healthcare systems are beginning to think this way. I think one way that is very important that companies begin to think is in terms of team healthcare rather than individual delivery by one doctor or one hospital. An example of that is how nutritionists or nurse practitioners or podiatrists can team with physicians for the kind of attention to detail that I just mentioned. And I believe that there are movements in the country beginning to spring up that adopt this philosophy.
So do you have to employ a gabillion people to get this done? It sounds like your attention is so close that it would just take lots and lots of nurses and aides to get it all done.
We do employ a lot of people, but the cost of employing those people far outweighs the savings, or the savings far outweigh the costs in terms of the healthcare outcomes of our patients. And so we employ podiatrists, mental health practitioners, nurse practitioners, a lot of medical assistants, a lot of home health aides, and we deploy those teams to the kind of detail that we've been discussing.
Well, I have to tell you, I read a story in The Atlantic that detailed how your company operates, and it really is attention to detail. You know how the elderly live in their homes and what kinds of daily problems they face, and you treat on the basis of that. It's really phenomenal. Congratulations to you, and I hope sometime you'll come back to the show, and maybe we can have you in a panel. You can teach a few more people how to do business.
I'm sure our physicians would love to engage and help teach others.
All right. Well, thank you so much. Have a great afternoon.
Thank you for having me.